Every fitness influencer on this platform is telling you to do face yoga, chewing exercises, and mewing to burn face fat. But that's physiologically impossible. Your face muscles are too small to create any meaningful caloric burn. So, let's talk about the most famous study supporting facial exercises. You know what happened? 41% of people quit before finishing it. There was no control group, and it was written by the guy selling the face yoga program. That's like asking a car salesman if you need a new car. But there's good news. While you can't burn face fat with chin exercises, you can fix the structural problem underneath. And that's what 99% of content creators don't understand. Your double chin isn't always about having too much fat, it's about having weak muscles that can't hold that fat in place. So, I'll give you the exercises that actually work, backed by clinical studies from speech therapy research that nobody's talking about. But before I show you what works, you need to understand why you have a double chin in the first place, because if you don't fix the root cause, you're just wasting time. There are 3 reasons, and you probably have all 3. Now, hear me out. 40% of people with normal body weight still have a double chin. It's genetic, and doing 100 chin lifts won't fix it the way you think. I know that's not what you want to hear, but that means you can be 12% body fat with visible abs and still have a double chin. And if you wonder why, it's because your DNA controls where your body stores fat, not just how much. Here's proof that it's genetic. 72% of people with double chins have at least one parent, sibling, or child with the same problem. If your dad has it, you probably have it. If your brother has it, you probably have it. According to the National Institutes of Health study, the submental fat compartment of the neck, you have a specific fat pocket under your chin sandwiched between your skin and neck muscle. Your genetics built that pocket. Some people got a small one and others got a big one. So look at your family. If they have double chins, you probably inherited the same fat storage pattern. But that's not all. Look at your posture right now. Your head is probably pushed forward from staring at screens. That position is creating your double chin. Here's why. Every inch your head moves forward adds 10 pounds of weight on your neck. At a 60-degree angle, like when you're scrolling on your phone, that's about 60 pounds of pressure on your neck. It's like carrying a bowling ball on your shoulders all day. This does 2 bad things. First, it mechanically pushes the fat under your chin forward, like squeezing toothpaste out of a tube. The space between your jaw and chest shrinks, and all that tissue has nowhere to go but out. Second, it shuts off the muscles that are supposed to hold everything tight. Your neck muscles get weak and can't keep the skin and fat pulled up anymore. A study published in 2021 tested this on 43 college students. They fixed their head posture with simple exercises that I'll show you later. What they found is that their neck angle improved from 48.4 degrees to 69.4 degrees. You could literally see their jawline tighten. So, translation, if you're sitting with your head forward right now, you're actively creating a double chin even if you don't have excess fat. Fix the posture, and you can reduce double chin appearance by up to 50% in 4 to 6 weeks without losing a single pound. Now, look at the area under your chin. There's a group of muscles called the suprahyoid complex. They act exactly like a hammock. Its job is to hold the floor of your mouth up tight against your jawbone. When these muscles are strong, they pull everything up. Your chin stays tight, your jawline looks defined, and the fat under your chin stays in place. But when they're weak, the hammock gets loose. Gravity takes over, and everything sags down. This is why you can have a double chin even if you're skinny. The fat is there, but the muscle isn't holding it up. If you don't believe me, try this right now. Look in a mirror and swallow. Did you see that? For 1 second, your double chin disappeared and your jawline looked tight because swallowing forces those muscles to contract and pull everything up. The problem is, as soon as you stop swallowing, they get lazy and drop back down. So we don't need to burn fat. We just need to tighten the hammock so it holds that swallow position naturally 24/7. And that is exactly what these next exercises will do. But before we build the muscles, we need to fix the mechanical problem first. Remember, your forward head posture is pushing the fat under your chin forward like toothpaste. If you don't fix this, all the exercises in the world won't help. So, exercise number 1, chin tucks. Here's how to do it. Sit up straight in a chair. Place your back against the backrest, shoulders relaxed. Look straight ahead, pick a spot on the wall at eye level, and keep your eyes on it the entire time. Now, slide your head backward like you're trying to give yourself a double chin on purpose. Not up, not down, just straight back. you should feel a stretch at the base of your skull, that tight spot where your neck meets your head. That's what we're targeting. Hold this position for 5 seconds. Keep breathing normally. Don't hold your breath. Then relax and return to your starting position. That's 1 rep. Do 3 sets of 10 to 15 reps and rest for 30 seconds between each set. Aim to do this at least 3 to 5 days per week. Now, here's what most people miss. You can't just do the exercise and then go back to bad posture for the rest of the day. That's like brushing your teeth once a week and expecting them to stay clean. Set a timer on your phone for every hour. When it goes off, check your posture. Is your head pushed forward? Pull it back. Make it a habit. Within 4 to 6 weeks of doing this, you'll notice your jawline looking tighter, and as I mentioned above, everything is backed up by studies. Now, let me refresh your memory a little. Remember those suprahyoid muscles I talked about, the ones that form the hammock under your chin? A 2023 systematic review tested every exercise designed to strengthen those muscles. They compared traditional exercises, the shaker exercise, and this one. The exercise that I'm going to show you activated the suprahyoid muscles more than anything else, and it did it with less neck strain, which means you can actually stick with it. This comes from medical research on patients who couldn't swallow. Doctors needed to strengthen these exact muscles to help people eat again, and it worked. But the side effect? A defined jawline. The name of the exercise is chin tuck against resistance. And here's what you need. A small rubber ball about the size of a softball. You can get one at any store for a few dollars, or just tightly roll up a hand towel. So, sit in a chair with your back straight. Use that good posture from exercise 1. Take the ball and place it under your chin, tucked between your chin and the top of your chest, right where your double chin is. Now push your chin down into the ball, not gently, as hard as you physically can, like you're trying to squeeze all the air out of it. Within 2 to 3 seconds, you'll feel the muscles under your chin start to burn. Hold that maximum squeeze for 60 full seconds. Keep breathing and don't let up on the pressure. Then, after resting for 30 seconds, do it again and repeat for 3 to 5 total sets. On your last set, after the 60-second hold, do 30 fast pulses. Squeeze, release as fast as you can. This fatigues the muscle completely and forces adaptation. Here's what's important to know. This isn't a quick fix. This is strength training for your face. Just like you wouldn't expect big biceps after 1 week at the gym, you won't see results immediately. But if you do it once per day, 5 days per week, for 6 weeks, the changes will be visible. Now, let's talk about something that won't build muscle or burn fat, but they'll eliminate the puffiness and water retention that's making things look worse than they actually are. Your face is probably holding 2 to 5 pounds of water weight right now, and it's because of sodium. When you eat too much salt, your body pulls water into your blood vessels. That water collects in your facial tissues, creating puffiness under your chin, around your eyes, and in your cheeks. A reanalysis of the DASH sodium trial found that people eating high sodium diets were 27% more likely to report bloating. So keep sodium under 2,000 milligrams per day. That's less than 1 teaspoon of salt. Do this for 2 to 3 days and watch your face tighten up. It's not permanent fat loss, but you'll look noticeably leaner. Then we have alcohol. It does 3 things that create a puffy face. First, it inhibits vasopressin, your anti-diuretic hormone. This causes dehydration, followed by rebound retention, where your body holds extra water to compensate. Second, it triggers inflammatory responses that cause your blood vessels to widen and leak fluid into surrounding tissues. Third, it slows lymphatic drainage, so fluid accumulates under your chin and around your eyes. Studies show regular alcohol intake is directly linked to under-eye puffiness and mid-face volume changes. So, if you drink regularly, this alone can make a massive difference in how defined your jawline looks. Okay, sodium and alcohol were pretty obvious ones. But when your neck muscles are tense from stress or poor posture, lymph fluid gets stuck under your chin. It just sits there, creating puffiness. Reports indicate that double chin appearance can decrease by up to 50% after lymphatic drainage massage in some cases. That's temporary, but it shows how much fluid retention is affecting your appearance. Do this simple self-massage. Using light pressure, make sweeping strokes from the center of your chin out toward your ears. Then, And this is the part everyone forgets. Stroke down the side of your neck to your collarbone. You have to push the fluid out toward the ears and then down into the lymph nodes to actually drain it. Do this for 2 to 3 minutes daily. These are your quick wins. Fix sodium, cut alcohol, do lymphatic massage. Within 3 to 4 days, you'll see a tighter face. But now we need to talk about the hardest truth, the one nobody wants to hear. Here it is. If you have actual fat under your chin, the only way to remove it is to lose body fat from your entire body. You can fix your posture, you can strengthen the muscles, you can reduce water retention. But if you're carrying excess body fat, none of that will give you a truly defined jawline. But here's what research does tell us about face fat and body fat percentage. University of Toronto research found that you need to lose 8 to 9 pounds, 3.5 to 4 kilograms of total body weight before facial changes become noticeable to others. For increased attractiveness ratings, where people actually notice your jawline looks better, you need to lose 14 to 18 pounds, 6.3 to 8.2 kilograms. For men specifically, jawline definition typically emerges at 10 to 15% body fat. Some guys see it at 15%. Others need to get down to 10%. It depends on your genetics. Remember that fat storage pattern we talked about. Now, before you go, I need to say this. This channel is for educational purposes only. I'm not a doctor and I'm not a physical therapist. I'm someone who researches science and breaks it down so you can make informed decisions. Everything I showed you today is backed by peer-reviewed research and clinical studies, but everyone's body is different and everyone's genetics are different.